Welcome from the care team at Roswell Park Comprehensive Cancer Center. We created this video for patients and caregivers to explain what goals of care discussions are, why they matter, and how they can help guide your care throughout your treatment journey. A cancer diagnosis can feel overwhelming, and it's not always easy to know what comes next. That is why open and honest conversations with your care team are so important. Goals of care discussions are conversations you have with your doctor and care team over time about what is happening with your cancer and health, what matters most to you, and how to make sure your care reflects your goals, values, and wishes. At the heart of it all is one key question: what are your goals of care today? This question opens the door to clarity, shared decision making, and care that is truly personalized to you. And because your priorities may change over time, it is a question your care team will return to again and again. Although every person's journey with cancer is unique, many face similar crossroads along the way. There are three common paths that may arise, and understanding them can help you feel more prepared for the conversations ahead. For many patients, the journey begins with the first path, the goal of curing the cancer. Treatment may include surgery, radiation, chemotherapy, immunotherapy, or cellular and transplant therapy, all aimed at eliminating the cancer entirely. These treatments can be demanding, but they can also be life-saving. For many patients, this path leads to remission or cure, and those victories are celebrated every day. Because cancer can be unpredictable, it helps to understand the other paths as well, so that if your situation changes, you feel prepared rather than caught off guard. On a second path, when cure may not be possible, the focus shifts to controlling the disease and living well with cancer. This may mean continuing therapy, exploring new treatments, receiving localized therapies, enrolling in a clinical trial, or taking a planned treatment pause to rest and regroup, all while preserving as much of your everyday life as possible. Along any of these paths, from the very beginning, there is a layer of specialized support called palliative care. Palliative care is not a last resort, and it is not the same as hospice. It is expert care focused on managing symptoms and side effects while supporting your physical, emotional, and spiritual well-being at every stage. It is available to every patient on any path at any point in treatment. During the second path, there may come a time when cancer progresses despite treatment, or when continuing therapy no longer aligns with your goals. At that point, it may be time to consider a third path. Here, the focus shifts to comfort, symptom management, and supportive care. The goal is to help keep you as active and comfortable as possible, often at home while avoiding unnecessary hospital admissions. When the time is right, hospice care offers compassionate support for you and your family, with comfort and guidance when it is needed most. This path is just as important as the others. It is a courageous choice focused on quality of life, dignity, and what matters most each day. Over time, you may move from one path to another and have changing goals and wishes. That is completely normal. The most important thing is to keep the conversation going as your health, priorities, and wishes evolve. Throughout your journey, your care team will ask, what is important to you? What matters most? Your answers help shape every decision about your care. And if you have a caregiver with you, a partner, family member, or close friend, their voice matters too. By staying engaged, sharing openly, and working together, including through advanced care planning, you help build a plan of care that is truly yours. At Roswell Park, you do not have to walk this alone. We encourage you to speak with your doctor or care team about your current path and your goals of care today. You do not need to have all the answers, just the willingness to talk. Your care team is ready to listen, and whenever that conversation happens, it is always the right time to have it. Thank you for watching.